Well, there's been a big push to get women vaccinated for the human papillomavirus, or HPV as it's known for short. 4 provinces have programs in place to vaccinate girls between grades 4 and grade 9, but now the federal government is making a push to get men treated. Our medical specialist thinks that should happen sooner rather than later. Dr. Karl Kabasele joins me now. First of all, Dr. Karl, what's the rationale behind getting boys vaccinated with HPV vaccines?
Well, you know, it's very similar to the rationale for girls. We know that these vaccines are safe and effective, and when it comes to boys, the vaccine may not only protect them against certain cancers and genital warts, but it may also help to protect their partners as well.
Okay, how would it work?
Well, it's basically, again, similar only in the sense that for boys, though, we're talking about slightly different cancers. We know that obviously men don't get cervical cancer, but some of these same strains of the human papillomavirus can increase a boy's risk or cause penile cancer, anogenital cancer, as well as genital warts or anogenital warts. So just the fact of being able to prevent those things, even though they may not be prevalent cancers, it can still go a long way in just having the power to prevent cancer with a vaccine can go a long way in improving health.
What are the ages that health officials are recommending for boys to get this vaccine?
Well, at this point, the recommendation is boys between the ages of 9 and 26, which is a similar recommendation as it has been for girls. And at this point, I mean, this is a recommendation. So it's not that it hasn't been instituted into policy at this point, but this is a recommendation coming from a panel of experts who've reviewed the evidence.
Why do you think it should be done sooner rather than later?
Well, I mean, there always, when it comes to these types of vaccines, for some reason, there seems to be a lot of controversy. So there's a concern that, you know, because what we're vaccinating against is called a sexually transmitted infection, that this in some way is going to challenge, I don't know, the morals or the character of kids.
Well, some people are probably afraid it may encourage, the way people talked about the pill giving, you know, young girls the pill too early, that it might actually encourage sexual activity among kids.
Well, exactly. But I think that what we need to do is take a step back and look at it from a public health perspective. We have the power here to use a vaccine to potentially reduce the incidence of cancers. And I think that's the bottom line, and that's why I think that it ought to be used sooner rather than later.
All right. Well, it's very difficult to convince parents. What you're saying is you don't know for sure, and they might be having sex. Why? But why someone so young, like 9 years old?
Mm-hmm. Well, what we know is that over a person's lifetime, the estimate is that maybe 75% of people will be infected with some strain of HPV. We also know that it's a sexually transmitted infection, so most people who've not had any sexual contact wouldn't be carrying the virus. So it really makes sense to get the vaccine to kids before they have their first sexual contact in order to maximize its potential to protect against these strains of HPV.
All right. The CBC medical specialist, Dr. Karl Kabasele. Thank you, Dr. Karl.
Thank you.